all the 47 countries have reported cases, there's none that has not reported any case. And so far, as we all know, the pandemic in Afro, in that East African region, has evolved in three main waves. Although in some countries, like Kenya and Algeria, these have experienced a fourth wave. The last wave is still ongoing in some countries, while in many countries it has come down. The pandemic response in the region has been characterized by some key challenges. And these challenges mainly include the difficulty in maintaining adherence to the public health and social measures. This has been quite challenging. The other challenges include the low testing capacities, coupled with inappropriate testing strategies, leading to under-detection of cases, particularly those that had mild or no symptoms. It is estimated that within the African region, only 1 in 7 cases occurring in the region has been detected. The other challenge has been low availability of vaccines, but also we have had the challenge of vaccine hesitancy that has affected vaccine uptake even when vaccines have become more available. Then the issue of infodemia, and then circulation of the new variants of concern, especially the Delta variant that has been detected so far in 89% of the countries in the African region. As we know that this has caused a lot of cases with the high transmissibility. Furthermore, the pandemic has caused unprecedented health and socioeconomic impacts to the weak health systems in the region and of essential health services, but also there was inadequate preparedness and insufficient response capacity by the time the pandemic emerged, which was countries. We have learned several lessons from this pandemic that we must put into consideration in emergency and pandemic preparedness before. And one of the key lessons learned thus think this meeting organized to discuss with member states about public health pathogen genomic surveillance is a very important meeting. Since the inception of COVID-19 pandemic in November 2019, as you all know, through genomic surveillance, several variants of the SARS-CoV-2 have been detected in the population, including the original one, which was first detected in China, but also several variants of concern that emerged, like the Alpha that was first detected in September 2020 in the UK. We also had the Theta that was first detected in South Africa in May 2020. And then there's the Gamma that was first detected in Brazil in November 2020. And Delta that was first identified in India in October 2020. Due to human movements, these variants associated with higher transmissibility than the original strains have been introduced into different countries globally, and they have contributed to spikes in cases at different times. We note that Alpha was 50% more transmissible than the original one, 50 was 25 more transmissible than the original one, and Delta 97% more transmissible. Although the public health social measures are majorly the same for the different variants, but there is need sometimes to adjust the intensity of the implementation based on the variant that has been detected. Currently, Delta is the predominant variant globally and regionally. It has been detected in about 99.7% of samples sequenced globally in the last 2 months. So it is really the dominating variant. However, we cannot say the Delta is just the dominant variant. It's very important to strengthen genomic surveillance to continue monitoring circulating strains and enable us to identify and evaluate any new variants that come up and them as variants of interest or concern, and we respond to them accordingly. I would like to thank member states that have adopted the WHO and Africa CDC guidance and made efforts to conduct surveillance of COVID-19. To guide genomic surveillance of COVID-19 in the region, Africa CDC and WHO AFRO recommended representative sampling approaches for countries to follow in order to monitor circulating variants. And the detected sequences are deposited in a global platform by country. We note that by 20th of November, which was yesterday but one, about 37,000 sequences had been deposited in this global platform by the it is so, although it is much than what other countries in other regions are doing. But through analyze and show that from those sequences, only 3% of the sequences were of alpha, percent were beta, and the majority, which was 43%, was delta. Africa, East and Southern Africa, delta is still the lead is one. So I would like to note that some few countries now, some, while others are uploading the data, but not timely. This could preempt the vision and could impact the response efforts. So countries are set up regular consistent manner for all of us monitor what is happening within our region. Information can act an early warning signal to the region of a possible resurgence or upsurge, and hence guide enhanced preparedness and the necessary response. Now, considering the evolution of COVID-19 in Africa, the response actions we have made, accomplishments, and lessons learned in the past 22 exercises conducted globally and regionally, at WHO, we think that three factors might impact the evolution, dynamic, and intensity of COVID-19 in Africa in 2022 and beyond. And these include the level of risk of reinfection of people who have already been affected by COVID-19, the level of acquired immunity of the population, either through natural infection or vaccination, and the occurrence of new variants of SARS-CoV-2 with higher transmissibility or even higher virulence. The combination of these three factors with the other pre-existing factors such as the increasing fatigue in the population to adhering to the public health and social measures, the low rates of vaccination and weak health systems, we think will determine the evolution of the pandemic in the African region in 2022 and beyond as we go forward. So this highlights the importance of genomic surveillance in informing our response in 2022 and beyond. Without genomic surveillance, we will not detect timely transmission of new variants if they emerge. Timely and reliable information on circulating variants is key to public health decision making concerning the reduction of transmission and monitoring of implications of vaccinations and therapeutics. Now, I want to note that genomic surveillance is not only important for COVID-19. We have used it in the past to inform influenza surveillance and response. We have also used it in Ebola virus disease response to identify sources of infection and detect transmission chains, among others. From the lessons learned from COVID-19 pandemic, it is important that countries develop, strengthen, and sustain genomic surveillance capacity, not only for COVID-19, but also for other pathogens. WHO Afro and Africa CDC are jointly supporting countries to establish this, and more will be discussed about this in this meeting. It is important to note that a successful public health genomic surveillance program must be fast, it must be reliable and open with data and sharing the data in a timely manner to inform decision making and planning. It is an important public health tool that will not only help control the current pandemic, but also allow Africa to rapidly respond to future pandemics. As you are aware, or you may be aware, the world is already having discussions about prevention of future pandemics. Strengthening public health genomic surveillance will be a key intervention in this effort. So I say